The Balanced Mind Institute would like to introduce you for this micro training sexual history interview, how it affects others and how it affects you. My name is Jeff KukralJ. I'm a licensed marriage and family therapist and your host for this micro training. Not really, as I have not graduated yet, nor am I licensed. This is for an assignment under Dr. Dale Bertram for our week 6 and uh, marriage and family therapy for North Central University. I am covering myself here just in case the California BBS sees this online and thinks that I'm misrepresenting myself. Again, this is just for class. This is not real. I'm not a real licensed marriage and family therapist. Just playing one on TV. As a current employee or a volunteer here at Balanced Minds, we consider you part of the family. And as a family, we support and encourage everyone with as much information sharing as we can. So if you want additional readings, trainings, or a list of the references, please talk to your assigned supervisor. Balanced Minds has a large online library that you can utilize. So please feel free to check that out. At the end of this presentation, we will also direct you to some additional resources that we do want you to take a look at. Um, as a member of Balanced Mind, you are more than welcome to do your own research. Just make sure you talk to your supervisor with whatever you see just to run it by them and to get approval. So you may be there asking, what is this training about? Why am I required to take a look at this? Well, first part, Balanced Minds, we offer these micro trainings to help improve our work with our clients. We try to give out ideas. We try to make everyone a little bit uncomfortable and that will make them reach out and learn something new. This particular training, though, we're talking about the sexual interview. There is a time in every marriage and family therapist's life where there's need to take a sexual history. And this usually brings on embarrassment. I know I was the first few times I've ever done it. I still get a little embarrassed because I'm asking some very personal information. I swear sometimes it almost feels like it's easier to ask about violence and trauma and things like that than what do you like to do in the bedroom. The client will be asked questions of the most private nature, and you, the therapist, can be uneasy asking such questions. So then you ask, if it's so embarrassing for the therapist and the client or clients, then why? Well, first thing is clearly if the client's there for any kind of sexual issue, that's the reason why. If you're here for, something doing sex, you need to know what exactly it is. But however, if without sex or anything like that, sexuality is part of the human condition, and understanding how that is affecting our client or clients is important from a systemic point of view. So now that we know the why, because we need to know, let's come to the actual act of doing it. Or in front of you right now, you see 5 bulleted parts. 5. These are the 5 P's. We want to talk about the past sexual infections, STIs, STDs, diseases, venereal, AIDS, herpes, things like that. Then you want to know about their sexual partners, Sexual practices is 3. Pregnancy, past or plans. And then finally, 5, prevention. Again, these are the 5 P's. We want to keep these in our mind as we're talking about them. This is our guiding light, basically. Okay, now with the 5 P's out of the way, we want to know how. But how is the name of the slide? The most important part is that as the person, is you need to remain calm. Calm, collected. And in a way, you need to remain clinical, okay? I don't know about you, but personally, when I'm talking to people in my sessions, I try to lay back. I try to kind of like mimic being their friend. It opens up. However, at this point, you kind of want to be clinical. You want them to understand that you're asking this for a specific reason. You're not trying to be nosies or anything like that. Remember the purpose of the interview. Remember that you're trying to grab that information to understand them and what's going on. And remember, the client or clients are just people. From our resources and our friends at California PTC, quoted and rephrased, try not to make assumptions about the people. Remember that there are no cookie cutter relationships or family or emotional systems. Everyone is different. You might have, to the outward appearance, people that are very straight laced and, nuclear family, back from the 50s, but in the bedroom, they might be a little, to use the word, freaky. We all know that. And so you can't make assumptions about anyone or anything. You also need to be open to their story. They're telling you they're there for a reason, so you have to honor that. Be there for them. Be clinical in your purpose, but not in your communication. So kind of remember, like, you don't want to always use technical terms. You want to mimic what they say, try to use their vocabulary. Be there for them, but keep in the back of your mind what you're doing when you're doing the sexual interview. And finally, do not judge. This is not your life. You do not have to want to do it. You do, like, for example, if you have a plural relationship group coming in, you don't have to want to do that yourself, but you're there to help those clients. And so you need to remove your judgment as best you can. If you're having trouble, seek out your supervision. That's what we're here for. So you've removed your bias, your thoughts on these, because you have to do it. Your clients will vary. You might be presented with a male, a female, non-binary, LGBTQ plus community, even children, young adults, youth, adult, older adult, anyone from a different nationality, anyone from a religion or one that doesn't have any religion, or someone that's suffering from past trauma or societal issues or stigma. These are all the types of clients that are actually going to be coming for you. And their issues might be of sexual nature, or you need to understand what's going on sexually with them. It's hard. On the left-hand side, you'll see three underlined hyperlinks. These are two other YouTube videos that you can check out. Tips for taking a sexual history. Now, these two kind of focus on women because you need to remember your demographics of your clients and understand how, like, for example, a man talking about sexual issues is way different than a woman talking about sexual issues, or a Caucasian talk versus a Native American or an African American. But then I also want to talk to you about one of the things that personally, as a therapist here, sexual assault survivors. It's a very short link to their Me Too story, and how that can affect them in the bedroom. And they actually might want to get the help, but yet a past trauma, or in this case, unfortunate rape, might sideline a lot of those efforts. So please take the time after this to go look at those videos and kind of understand. And then search for other ones out there. There's lots of stories out there. The more we can be exposed to these stories, even though it's heartbreaking for us, we can kind of empathize a little bit more and understand, and bottom line, help our clients. Well, after that last slide, anytime you talk about rape and sexual trauma and any kind of trauma, it kind of brings down the vibe. I try and make these micro trainings fun for you as the CEO of the company. But that was hard. We have to recognize that there's trauma. So, but moving on now, let's get to our first P, past sexual infections, STDs, STIs. It's important to know because the past issues can cause a variety of mental health problems or issues. For example, stress, anxiety, pain and suffering, but then also marital, friends, and family stress. Now, I'm separating these from regular stresses because I'm thinking stress at work. If you're going to the bathroom, for example, all the time, that causes stress. However, what if you got an infection because you're a male and cheated on your wife with another male, or something along that lines? The marital, the friends, and the family stress to me is I'm separate. Uh, but one thing I do want to keep you, especially on this, I want to keep you aware of is please stay within your scope of practice. A lot of the information we have for the sexual interview and learning this is from a medical point of view. We, again, are not doctors. We are not medical people. We can hear what's going on. We can hear, for example, medication, but we can't recommend any medication. That's for the doctor. We don't know that. So please, when you're talking about sexual infections, STIs, STDs, and cures and things like that, make sure you're staying within your scope of practice. That is one of the most important things to do for your protection and that of balanced minds. Okay, now that you know about any kind of infections or any problems, basically sexually they have there, we move on to the sexual partners. You must ask this question. You have to know not only the number, is someone seeing multiple partners monthly, weekly, yearly, whatever, hourly. You need to know that, but you also need to know the type. Is the male at birth sleeping with only females at birth? Or is the male at birth sleeping with both female, male, pan, uh, bi, anything? Are they seeing both? Are they seeing non-conforming people? Also, another thing not add on here is, are they sleeping or having sexual relations with other people that are doing risky things? For example, let's say a husband and wife, um, and the wife is deciding, they opened up their relationship. Husband's not going out and seeing anyone, but the wife is sleeping with a lot of other people. Not only do you need to know the type of sexual people, but also what risk behaviors those other people are seeing. It's convoluted, but as the therapist here, and you're trying to entertain the idea or get the information, you need to ask. Don't be scared. Be clinical in your thought process, but be there and friendly for them in your words and actions. But definitely ask. Okay, so far you have asked your client or clients about any diseases or medical issues that they might have, so you can understand. You've asked them, a number of partners and who and what they've had sexual relations with. But now we come to what I consider the hardest part in the questionnaire. This is about sexual practices. Sometimes there's an honor about the types of number of, honor about the types or number of sexual partners. What kind of sex is a different story. It still needs to be asked though. Are the people into BSDM, fluid play, diaper play, and on and on and on? Is it even illegal? Or is it even legal? Most things between two consenting adults, even some pain can be. Everyone has to be involved, but is the person a pedophile? Does the person like younger kids? These are things that they come to. Please remember when you're talking about this that we have to remind people of our mandate report, that we are, authorized by, our licensing, that we need to let the authorities know if protected classes are being abused. So keep that in mind, but we need to know. So some probing questions, basically, kind of think this in your mind. Make this your own, but do you practice oral, anal? Is the penis touching or inserting into another penis or a vagina? Is the vagina touching another vagina or other body parts? Make this your own. Ask it, but you have to kind of understand what sexual practices are they doing. BSDM, for example, do they have safe words? Do they have proper kind of like training and, quick release? These are things that need to be known, and you need to kind of educate yourself on that. Be careful what you search for, especially here at Balanced Mind on the computer, but ask your supervisor if you have any questions or are confused. Okay, this pregnancy past or plans is a little bit easier than, or at least in my mind, than asking them what kind of sex the person or couple likes. But the purpose, basically ask about the pregnancy past or plans, is the purpose to help the clients understand the risk of parenting a child or how past children or abortions or even miscarriages can affect their romantic system. How does that affect them? Are they getting trauma because they had a miscarriage? Do they feel a stigma because they had an abortion? Or are they actually, a couple that are having fertility problems and they're trying to have, children? These are all questions we need to know. So that's why asking about pregnancy, past or plans, is important. This goes to men too. Is the man, for example, and I'm talking biological at birth man, willing to father a child? From the CDC, based on our partner information from the prior section, you may determine that the patient is at risk of becoming pregnant or fathering a child. If so, first determine if the pregnancy is desired. Questions should be gender appropriate. This is from one of the references that we're going to provide you later, but it's from the CDC, and it's basically a guide that you can carry with you, since you can't carry this presentation with you, to help you at each interview. Again, take it, make it your own. Here we are at the final P, prevention. What is your client's views on prevention? Are they trying to avoid anything? Are they not trying to avoid anything? Do they want children? Do they not want children? Do they want an STD? Believe it or not, there are a few people that do. Or are they trying to avoid it? And we need to help here. The final tie-in here. We can tell a lot about our clients on their answers to this question. What are they looking for? What is their ability to kind of think outside or for the future, what's going to affect them. It brings up a roadmap for our help. Is the person able to effectively or efficiently, navigate personal relationships, sexual relationships? And again, though here, be careful in your scope of practice. A lot of times, if we get into prevention, I've had in the past, a female client, for example, will ask, well, should I take this birth control? That's not our choice. We can tell them what we've heard in the past, like, oh, IUDs do this, or, some women experience this on birth controls, but always clarify they need to go speak with their physician about that. We can't help them decide. Okay? Well, we made it through the 5 Ps, but now what? The question is, what about you, the therapist? This is hard. We all deal with some issues, and we people come in with this trauma all the time. We deal with divorce, death, drug abuse, things like that. So, what about you? Are you taking care of yourself? The following will kind of help you here. We'll figure things out together. Okay, so we're taking care of yourself. We're dealing with sexual questions. So let's be honest here. Some of the questions can make you feel uneasy. It happens. The feeling is natural, but it's your response that we need to help and control. Some of these questions or responses that you get might possibly excite you. It happens. The feeling is natural. It's your response that we need to control. If you get a client and they are sexually adventurous and that stirs something up into you, being human, it's understandable that part of your brain hears that and thinks that's exciting. Hell, you might even get turned on a bit. But how you control yourself, remain professional. Do not let it show. And then talk to your supervisor afterwards, because we need to discuss that. Will you be effective from that point forward? As a professional, I trust in all of you that you'll be able to. That's the reason why you're hired here. But just keep that in check and understand. Some of the discussion might make you emotionally sick or spiritually sick. It happens. The feeling is natural. It's your response that we need to control. And honestly, you kind of need to remove yourself from that situation. You're here to help them. You are not a judge, jury of their life and their choices. You are there to help them navigate the questions that they have. Seek your supervision. This is what we're here for. Even after you become licensed and if you become a partner here, or even go by, we offer, supervision sessions, but we also just do lunches. If you've been working here for that long, again, your family, come, we can all talk. And nothing is too odd. We're therapists, for heaven's sakes. So if you're having some feelings, if you're having some questions, if you're having some uneasy feelings, let's talk it out. Okay, so as I spoke to you guys earlier during this presentation, we do have reference material for you. One of them is from our friends, and it's a how comfortable are you? Personal comfort self-assessment. I gave it kind of like an example of what this looks like here in this presentation. You'll see on the right. Basically, a scale 1 to 3. The actual thing is a little bit more involved, but mine is like basically, on a scale of 1 to 3, how do you feel talking about intercourse? How do you feel about talking about BSDMs or orgasms or sex with multiple partners, sex toys, oral sex, things like that? The actual self-assessment basically has 4 columns. I feel that I have enough knowledge to talk about this topic with a client. I feel that I have enough experience to talk about this topic with a client. Okay, so you have experience and knowledge. Or my own values will not conflict with my ability to talk about this topic with a client. Finally, what I can do to increase my comfort. Now, this is where if you're having issues, you're going to be checking that box and you're going to be talking to your supervisor about that because we want you to feel comfortable. Because if you feel comfortable and you act professional, that's going to help your client. Well, we are at the end of our presentation, pretty much. Uh, Here at Balanced Minds, we offer the needed supervision and a partnership. A little bit more than supervision. Supervision you need for your records, BBS, things like that. But also, we offer that partnership. We're here for you. We're all trying to lift each other up. Balanced Minds pre-session interview documentation. These are forms that we have, and we try to get the clients to fill them out before our first session. They're based on the Cardia toolkit, which includes a self-evaluation, the one we talked. We have intake information specific to women, men. We personally are currently developing one for the LGBTQ plus community, and then we have plans for other cultural and race versions as well, because these are populations that we are trying to reach out to, and as such, we have to have proper documentation for them, something that reflects who, what they are, and why they're here at therapy. We also have the interview guide as supported by the CDC. There's a link there, as supported by Kadara and our friends at California PTC. Remember, here at Balanced Minds, we expect you to kind of treat your sessions as your own private business, because that's how we grow. We're here as a community, as a collective. So make everything your own. Get approval. Take a look at it. I mean, because we all have to do, legal and correct work, get approval. But if you want to change things around, go for it as long as it's effective. Okay? Make it your own. Again, thank you very much.